Good afternoon. Thank you again, everyone, for joining us today on this, at least in North Carolina, rainy, fairly dreary day. Hopefully it's a little nicer where you are. My name is Rebecca Cooper. I'm the marketing director for MobileSmith, and we are excited to talk with you today and have one of our clients join us to really talk about some of their experiences in building apps and how they've done that. So before we get started, I want to go over a few housekeeping items. There's a control panel, a section on your GoToWebinar control panel on the right side of your screen that says questions. Please feel free to go ahead and put questions there as you think of them. If you're like me, you'll forget 2 seconds later if you don't write it down. So please feel free to go ahead and post those, and we'll save some time at the end for Q&A so we can make sure we get to those questions. Also, the webinar is being recorded, so if you want to go back and review any of what we talk about, or if you had a colleague who wasn't able to join us today, we'll make sure we get you a recording for today's webinar. So with that, I want to introduce Dave Solon. He is our VP of Product and Marketing, and he's going to be taking us through our webinar today.
Thanks, Rebecca. I really appreciate that introduction. Actually, the webinar today is going to be all about one of our clients, but let me tell you a little bit about ourselves first. MobileSmith, we are really on a mission to change healthcare one app at a time. We're trying to target the inefficiencies in the American healthcare delivery model and trying to address those by moving from kind of a paper-based mechanism to a more digital-based mechanism that's really aimed at having people use that powerful device they have in their hand, that phone that everyone uses, to be able to manage their health better. We partner with some of the top hospitals in the country, but today we're going to talk about one of our favorite customers, and that's Roper St. Francis in Charleston, South Carolina. And at this point, I'd like to just say a little bit about Krista Robertson. We've worked with her for quite some time now. I remember first meeting her, I don't know, it was maybe 18 months ago, coming up to training here at MobileSmith. And I just want to congratulate you, Krista, for being what I consider a healthcare change agent. I mean, we know healthcare needs to change in this country, and we appreciate those people who are willing to kind of stick their neck out, maybe get knocked around a little bit to actually try and make a difference in healthcare and actually improve efficiency, make it more consumer oriented, which is what all the patients out there are really looking for. So with that, I'd like to introduce you and thank you for leading our webinar today.
Thanks for having me today. I'm glad to be here and share my experiences. And before we start, I'll tell you a little bit about our health system and then how we kind of got into the overall mobile strategy. As Dave said, I work with Roper St. Francis Healthcare in Charleston, South Carolina, and we are a 3-bed hospital system, roughly 657 beds. And we have a 4th hospital coming here very soon. MOB opens this summer. And then, part of our problems is that we have a very small marketing team, and in particular, a digital team. There's 2 of us. And so when we were thinking about our mobile strategy, we had to take that into consideration in how we would handle jumping into this mobile arena. Also, we have very limited support from our IT department as well. So we really wanted something that would keep us make us self-sufficient and be able to turn out mobile applications in a timely manner. And you can move forward, Dave.
Sure, yeah. Well, yeah, let me tell a little bit about the background, running into you guys a little bit, is we really have been seeing this trend since we started in about 2013 doing this, but just in the last, like I said, 18 months, this trend accelerating toward people wanting to interact with their providers and interact with their healthcare system and manage their healthcare using their mobile phones. And we think part of that has to do with the demographic. We're starting to see more and more like Gen X and millennial people entering the healthcare system, and they have very different needs, and they manage their health differently. For example, you can see this one statistic that 71% of millennials want to use mobile apps to book appointments and share health data. I know with even my generation, that Gen X, the generation before that, we are also very digitally focused. And so this is really the sort of the backdrop. And I don't know, Chris, is this kind of the way you guys saw it when you got into this?
I'm sorry, I missed your question, Dave.
Oh, I was saying, are these the trends that you were seeing when you decided to get into mobile apps?
Absolutely. I mean, we were looking from a digital standpoint. Our mobile usage, obviously, on our website had increased substantially. It's over 50% now. And just knowing with the millennial audience that, their rise in mobile apps and usage, I mean, we felt like we had to enter into this market in some way. And part of the process was, just looking at how we could improve the patient experience overall and streamline some of the processes, particularly around this younger audience.
So you want to talk about your first app now?
Well, sure. Before we do that, I probably would like to go back and just kind of talk about how we started prioritizing our app development as well, because I think that's an important part of the process. We were constantly getting requests, and in order to manage those requests, we needed to really figure out a process of how we manage these requests, how do we prioritize these requests, and really have more of a strong strategy moving forward. So one of the first things we did, we created a steering or / governance committee, and that was made up of people in marketing, IT, communications, legal as needed, and then of course we had subject matter experts as well. And part of their role was to review and again prioritize the requests that were coming in and figuring out which ones really advanced our strategic initiatives. And as a requester, the individual will have to submit, for lack of a better word, an application that has some basic questions about the purpose of the app, what kind of problem is the app solving, again, what strategic initiative does it relate back to, and then they would submit that application to the committee for review. And as a committee, we would discuss kind of the pros and cons of the app, if we felt like it was worth putting time and effort into it, and it really did solve a problem that our organization was seeing, and more to the point, did it relate back to one of our overall strategic goals or strategic initiatives. So we put that in place early on, very early on, because again, we were having so many requests, and people request apps for any little thing. It's become like the trend. Oh, well, we can build an app for that. We can build an app for that. But is it going to be successful? Does it solve a problem? So we really left those decisions up to the steering committee. And so our first app that we started was Bariatrics. They came to us, and really they have this ginormous information booklet for, I mean, it was massive. I can't even describe how big it was. And one of their first initial requests was they wanted to stop printing these booklets, and really could we put this content into an app? And it made a lot of sense to us. And when we started looking at the audience, we found, and which we had known this through general marketing for the bariatric service line, that oftentimes the people who are looking into bariatric surgery, they use a lot of online tools because of the anonymity that it provides. And so we felt like the app would just help with that and help with their research. And again, with bariatrics, it's a long pre-op process. So how could we improve that pre-op process for the patient, ensuring that they achieve all their clearances in a timely fashion, and then help them move from into surgery faster. And then looking at also how can we help in the post-operative phase, because oftentimes that's going to be the determinant of whether the surgery has been successful or not, how they manage the post-operative phase. So when we looked at that, we developed some goals around again, increasing the number of patients to surgery, increasing overall patient satisfaction, and reducing readmissions. And then we also wanted to reduce printing costs of our booklet because it was massive and it was becoming an expense as well. That was kind of an added bonus. And then the patient doesn't have to carry around a huge packet, flip through information to find it. So that was kind of our overall goals with the app. And the app features education. It has a preoperative checklist, postoperative calendar. It has recipes because we found also we were getting a lot of calls in the bariatric practice for recipes or things that they could eat after surgery. And so that we felt like that was a very useful tool to add as well. There's weight trackers. There's also functionality for people to track their progress in with photos and then share those out. And one of the things with and how we're rolling this out is really, we've taken the approach of it's a prescribed app, and we're relying on the clinical team to roll this out at their first touch points with the patient. So the first appointment that the patient has, they will help them download the app and also go ahead and set up any of their preoperative milestones or checklists, which you can see here on the slide. So if it's not applicable, there's an ability to say this doesn't apply. And if it is applicable, then they have the ability to set a due date that will alert them and provide reminders that they need to accomplish that checklist.
Well, I'll talk a little bit about measuring the initial success. When we work with clients, we like to measure the initial success by just saying, are people using the app? And that's a pretty important metric. And so we gather and provide to Krista each month, more frequently if she needs it, metrics that show really how's the app doing. And so if you think about this as a prescribed app, as Krista said, and so it's not going to this giant population of users like a Facebook Messenger app, keeping in mind how many people are going through this procedure, going through the service line, what we see is actually a really good growth. You can see where people initially started prescribing it, and each month what you see is in the red line is the returning users, and these are people that were there from a prior month and they're continuing to use the app. And then the blue line is the new users, and then that becomes like the total users, which is the green bar. And you can see a sort of a linear trend of the returning users. That's going to increase. Our belief is that at some point that line will level out because there's just a fairly static population of the number of people that come into this service line, and then you have a successful surgery, and you may rotate out. So this is what we would consider kind of an episodic app. Although with this particular, with bariatrics, we feel like people may keep the app on the phone long term because it just has all those healthy living tips and so forth. But having said that, the next thing that we like to look at is what I like to call application stickiness. And what that says is how much are people using the app? And you can look at different apps out there in terms of, like, think of apps on your phone and the number of apps that you've used today, once a day, at least once a day. So you might say my email app, I use that every day. My web browser, I use that every day. These are core tools. Then you say, how many apps do I use at least once a week? And those are still some of the apps that are most near and dear to you. So for example, I may use LinkedIn as an app. I may use, if I'm traveling a lot, I might use one of my travel apps. Definitely my photo app I look at maybe once a week. And Dropbox might be one, so these are apps that you may, Yelp is another example. I might use Yelp once a week when I'm going out to eat. Amazon app, so these are ones I kind of big brand names use once a week. If you look at this chart, what you can see, the green line is the average number of sessions per user per month. And so what you can see is this green line is hovering around sort of 4 to 5 uses per month. So that would say this is an app that people are using once a week, which is, up there on the par of something like a Yelp or, as I mentioned, like a Dropbox or something like that you use on kind of a weekly basis. Now think of the number of apps you downloaded to your phone that you never use, right? That's what we would kind of want to avoid. So to see this, 5, it seems to be trending up a little bit. Started off really good, dropped down a little bit, then trending back up to about 5 uses, a little bit more than once a week. This is a really good number for us. And then what you see here is just that it's the red line is just simply the total number of sessions that are happening divided by the number of unique users or the unique sessions. So again, that's how we get that number of sessions per user. So really seeing some great usage. And I know, Krista, you've got some other key KPIs that you're going to be measuring more on the clinical side and on the ROI side that we'll talk about in a future webinar, I'm sure.
Yes, and I mean we're pleased with the success because it's doing what we intended it to do, to provide an educational tool for the patients so that it's easy at their fingertips. It's always with them on their app, their mobile device, and it's also helping them stay on track to get to surgery faster by providing those alerts for the pre-op checklist, and then again helping them with their care after surgery with the post-op information and follow-ups that they may need to have, because obviously with bariatrics is it can be a long process to get to surgery, and then afterwards it's dependent on your post-operative care, that will determine your success as well. So we felt like the mobile app was the perfect format to provide those additional support.
Okay, you want to move on to your next app?
Sure.
So I'll just give a little bit of background on pregnancy. What we're seeing is this is our most popular app. And a lot of the reasons there's, about 82% of the children being born right now are to millennial mothers. And therefore, that generation, the digital natives, the millennials that grew up using apps as their primary way of getting things done and communicating, this is just the expectation. They're not going to go buy a book. They're going to expect their healthcare system to provide an app. And if the healthcare system doesn't, they're going to go find one out on the internet. Interesting statistic on the internet, if you just go out to the App Store, about 45% of health apps on the App Store had no involvement of a medical professional, is the recent statistic, and only about 25% of the apps show any evidence-based practices being deployed in the app, much like what Roper's done with the bariatrics app. So doctors aren't looking at it, and then even when they are, they're not really using evidence-based practices to design the workflow. So you really don't want your patients going out and just downloading the prettiest app, with the nicest looking icon, from the App Store. You really want to provide this app to them directly. A second very important reason is because, particularly in the competitive market that we are in these days, healthcare systems merging together and so forth, you need to capture these people as they're entering the healthcare market for the first time. Often childbirth is the first time a young couple will actually place a bet on, hey, we're going to do this healthcare system for a period of time. Prior to that, they may be just going to minute clinics or whatnot. So this is really a time to capture and have this immersive experience. So this is sort of the backdrop again of why we really feel like pregnancy is a key service line to enable. And so I'll turn it over to you, Krista, to talk a little bit about how you guys are approaching it.
Yeah, so obviously it's the perfect target audience. The younger millennial audience. And again, some of our KPIs that we were looking at is we wanted to, again, reduce printing costs, because we spend a lot of money each year with OB packet materials and then discharge materials. We wanted to look at trying to increase class participation and registration. And then one of the things that we also were looking at is hoping that by not having to provide paper at discharge, that we could also use this app to help increase our HCAP scores for help at discharge and medication side effects. So those were really our main KPIs. And then also we're just tracking if there's an increase in our OB volume, and also if we see a change in the number of C-sections. Those are a little bit harder to prove that the app helped with those, but those are some things that we're keeping our eye on. And we have not launched this app yet. We're still in the process of development, but it will be similar in scope to kind of the bariatrics app, where it will be a prescribed app. We'll be relying on our OBGYNs in the area to provide this or encourage their patients to download it, versus in the past they were given these packets that had all these loose pieces of paper and materials in it for them to review and understand. So we're really focusing around, what do you need to know during your pregnancy? What do you need to know while you're at the hospital? What do you need to know afterwards around postpartum care and care for the baby? And our goal is really pregnancy through about 6 weeks of life is the information and content that we want to provide to the patient. And as you can see, we're going to include some things with kick counters, and we'll integrate our classes, a journal for them to kind of track their progress. There'll be a diaper tracker and milk output. We're going to be tracking feedings as well. A lot of information around breastfeeding. So it's really more of an educational resource, everything you need to know right in your mobile device. And again, we haven't launched this. We're very close. We're looking at an early May launch. So I'm excited to see how this will turn out and what kind of feedback we get around the app. And again, we're going to be relying on the OBGYNs to encourage our patients. We'll create a small panel card that will give them information about downloading the app versus having to create a massive packet that we were doing in the past.
Very good. So I'm going to ask you a quick question on this one. Is when we were discussing, we were down for the strategy session, I don't know, a couple of months ago when we were planning this app out, and you mentioned, I remember someone mentioning something about being able to use this to kind of target some of the HCAP score improvement. There's one that I didn't quite understand. What was this, like medication adherence or medication understanding?
Yeah, so it's part of the medication side effects and just overall health literacy and understanding the types of medicines that they are taking and how any other medications that they may have been given during the hospital affect them, particularly if they're already on medications that are prescribed by their doctor for for various things. So yeah, that's what it's really about. The two HCAP scores that we're tracking is really just information, making sure they understand discharge instructions and information around any medications that they are taking.
That's cool. You have specific subscores of the HCAP scale that you can target and measure improvement using the app. That's very neat.
Yes.
Okay. Well, I'm going to talk a little bit about the next app. I'll turn it over to you, but I really wanted to share some information about, we're really excited working with Roper on general surgery app. So again, when I think about healthcare change agents, people that are really trying to think about problems and inefficiencies and how healthcare is delivered, and then try and fix those. Again, we were down for a strategy session a couple of months ago, and I was just really intrigued with this approach. We did some research ourselves after the meeting, Krista, to really look into how you can use surgery apps or surgical apps for pre-op and post-op to drive efficiency. And what we came up with, I'll just take you through it just briefly, is using national statistics, we researched about 100 different journal articles and came up with sort of average rates for example, same-day cancellations, and then also kind of average rates for 30-day readmissions. And then we found what the typical costs are to a healthcare system for these. So for example, maybe didn't realize it, but like 37% of same-day surgical cancellations actually don't get rescheduled for a variety of reasons. Then we found a couple of studies that said how apps can improve that. And we averaged those together, about 40% improvement in the same-day cancellation rate if you deploy mobile apps with reminders and pre-op checklists and so on and so forth. Then on the other side, you can imagine with the preventable readmission, like you said, with the pregnancy app and the bariatric app, really that patient education, patient literacy, understanding how to follow your discharge instructions and so forth. We noted the cost of preventable readmissions and then the improvement on apps. And when you total this up, it's pretty significant. And not saying that any particular health system is going to realize these exact numbers, but our hypothesis is that you will actually be able over time to be able to measure real savings based on improving these rates. So having said that, why don't you tell us a little bit about what your plans are? I just wanted to let you know that we've been so intrigued by what you guys want to do here that it's really spawned an entire sort of line of research on our side to try and help compute the ROI in this. So how is your general surgery app going to work?
So those two key points right there are the things that we'll be focusing on: is same-day cancellations and lowering post-op readmissions, because those are obviously the two biggest issues that we see in general surgery. So the surgery app is a little more challenging. It takes a little bit more understanding, a little bit more involvement with the various clinical areas. But what the approach we're going to be taking is we're looking at our top 10 surgeries, non-emergent surgeries that are pre-planned, and we're looking across those 10 surgeries to see what the commonalities are, and trying to develop pre and post operative content that would relate to all 10 surgeries. And so with the same day cancellations, is typically we see the same thing, like maybe someone ate after they were supposed to, and so then it requires to cancel that surgery, or maybe they didn't follow some of the prep instructions that then would require them to cancel their surgery. So that's one of the big pieces that we're trying to focus on. But we want to look at how can we manage those across those 10 surgeries. Obviously, there's, every surgery and certain surgeries are unique, but there are those things that are common to all, and that hopefully we can manage those on the front end and the back end to manage these goals that we have.
Right.
So it's definitely going to be challenging because, we're having to look across a lot of different types of surgery, and a lot of different opinions and thoughts. So it has been a little more challenging to get off the ground, but I feel confident that we will. We've had a lot of interest and a lot of people excited about it. So I think that in the end, it'll be a great app, and I'm looking forward to seeing how it all rolls out.
Well, we are also very excited to work with you on it, but it kind of raises a question. I think we've got a chart on this, is what is the marketing team role in all of this, and what have your challenges been? Maybe spend a little bit of time on that.
Yeah, so in marketing, we already have those relationships with the service lines. We're building their marketing strategy from year to year and working on them quarterly, and so we have those relationships. So we really are taking the lead. And as I talked about earlier, we do have a steering committee that has representation from various areas, but we're really the leaders. We're the project managers that are pushing this through with our existing relationship, and we are building these mobile apps as part of their overall marketing strategy. So, not turning away from traditional marketing, but we're including it in part of that overall strategy along with their traditional marketing. So we've taken that lead, and that allows us to better coordinate with the clinical staff, because we're already working with them anyway. And it takes kind of IT out of that role. They're there on kind of a consultation basis, but with your platform, we really don't have to rely on them that much. And so it's just working with the various clinical people. And I would say, some of the challenges has been making sure, and that really kind of goes to the next area I think we're going to talk about it later, but some of the lessons learned is just making sure that we have the right people at the table from the start in all the clinical areas, because everybody does have, a different viewpoint. Marketing, we see things from a different point of view than actually from a patient care standpoint. So understanding both sides, from a consumer-driven side and from the clinical care side, it is critical that you have the right people at the table. And I'll even reflect back a little bit on our surgery app. While we haven't gotten as far as we wanted at this point, is that initially we thought we had the right people at the table. We had clinical representation, and then we had their business manager, and we had marketing at the table. And we went through a whole process of what we thought was the right path to take. And then in a subsequent follow-up meeting, we ended up having the service line director at the table. And that kind of made us shift gears a little bit from her viewpoint into things that were important to her. So, had we had her at the beginning, we probably wouldn't have, we would have be further along in the process. So that's probably the biggest lesson learned, is making sure you have the right people, you have the right subject matter experts at the table, you have representation from the patient care side to the business side, in order to get all perspectives and understanding, where are their pain points, what are some of the problem areas, would an app solve that? Just talking through all the challenges, so that then we can come to a quality strategy and move forward together.
Right. Well, absolutely. And, I have to applaud the getting that consumer viewpoint into the equation, because that's something I've been frustrated with over the years with healthcare. Is there's a lot of attention paid to everybody kind of but the consumer patient experience, making things convenient, making things easy, having good communication. And so I really think that having the marketing team in the leadership role, while albeit, you go through some trial and error, I believe that's really the benefit of going this approach is, imagine if you had more of an IT-led project where they spent a year architecting the perfect solution only to find out that the service director didn't like it. Whereas you can do some test apps, bring people in, do some storyboards, and get the right people to the table. And I'm sure as a result of doing that, it'll be a much better app.
Absolutely, and we've used that. So with the Bariatrics app, we've already done some revisions and updates based on feedback from the clinical team, feedback from the patients, trying to improve the experience there and expanding things more. And I'll give you an example with the Bariatrics app. With the pre-op checklist, we just put in a few options that pretty much everyone had to meet. But then as we talked to the clinical team, they really thought it would be more helpful to preload any clearance that the patient may potentially have to have. And if they don't need it, just mark it off. But that way it saved time. It was there already input into the app, and it was just a matter of either, putting a date to it or saying that it was not applicable to your care. So just constant communication with the clinical team and getting patient feedback to continue to improve the app is so critical. And So those are like my takeaways for sure. Just continue to have that relationship and communication with the clinical team and understanding how's the app working, where do they see it needs improvement, those types of things. And then, of course, having the right people from the get-go at the table.
Right. Well, that really sort of embodies the strategy that I think you guys have taken. We really want to drive this and are supportive of it as well. And we call it our Think Big, Start Small, and Act Fast. And so you have a big vision of all the different items that you want to address. You pick one app, you start small, you get it out there. The bariatrics app, you're already in your second revision of it, and it's or really third revision, even though it hasn't been out there much more than a year, or probably about a year, and you're already in your third revision, and you're getting that constant feedback. I really like the thing I remember from the strategy session where it's just a simple thing that was easy to change in the app, which is, like you said, when you have a list of clearances and the clinician is right there prescribing the app anyway, it's much easier for them just to delete the ones that the patient doesn't need than to type in the ones that they do need. So we just provide the master list and then customize they actually have a customized pre-op checklist for that patient based on what the clinician reviewed with them and decided. So, and it's all right there in the app. So I really like how you guys did that. I'm just going to wrap up here. We had a couple of other things that we wanted to cover. One was just what we call our blueprint catalog, and so as you can see, what the Roper team has done, and what Krista's done, is they've been able to build their own very custom. Their clinicians are completely involved. It's the protocols and procedures that their hospital wants to do, but they're built from these what we call blueprints, which are sort of the scaffolding or the frame out of the app, but it's completely branded from a marketing perspective, the consumer appeal, as well as the actual procedures and workflows are determined by what the care team there, in Charleston at Roper wants to do. And then the process that we go through, and I think this is largely the process that you guys have done, is you create these app plans, you build and release them, and then you manage them. And part of managing is continuous monitoring, and then identifying what updates you want to do to the apps. And one thing that we learned, and we kind of learned it working with you guys, is that sometimes you need a little bit of help. I mean, it's a lot of work, just sort of what I call the herding cats, getting all those service line leads and clinical people, IT people, just to come to the table. Just managing the steering committee is hard enough work, and so we're there to support you to actually make some of these changes quickly, so that when you want to come back to the next meeting and say, hey, we've made the changes, you're not, working the weekend pulling your hair out, like I got the answer, now I actually have to put the answer in the tool, and we're there to help you with a sort of managed services approach. So it's not, it's something you can do relatively quickly. Like you're getting 3 apps out probably inside of 18 months. The first one is already in its third revision. This is kind of unheard of from an IT perspective, where things can take, a year just to design and 3 years to deploy and that type of thing. So really nimble stuff here.
Yeah, I have to say, your model has really, it's great, because it has helped us, like you said, to move quickly. Whereas when we are relying on IT, we're fighting for all the other projects that they have on their plate, because they have limited resources, which we understand, but they can't always move at the pace we'd like to move. So the MobileSmith platform has made that, and your overall model of services has made that so much easier to conceptualize an app and get it to market quick.
Yeah, we appreciate that feedback, and we've been learning with you guys, and really glad to support it. At this point, I think it would be a good, just in the interest of time, people have busy schedules. Maybe we could open up the floor for a few questions.
I think we've actually managed to cover quite a few of the questions that came in, but we'll take a few of those. One of the ones that I think would be for you, Krista, is just around, you mentioned, kind of prescribing the apps via the clinicians from whether it's the bariatrics app or sort of the intended route for the pregnancy app. Have you had any successes or challenges with that? Like what has been the clinical response, and have you seen that to be effective?
No, we haven't had any issues. Again, I think it all boils down to the fact that we brought the people in on the front end and asked them where in their process or their touch points with patients would it make sense to prescribe an app. And we let them fit it into their processes and where they thought it worked best. And so far, we've had nothing but positive feedback from them, and pretty much every patient that comes into their initial visit, they're downloading that app and setting it up for them. So we honestly have not had any negative feedback. Now, because the pregnancy app has not launched, we'll see how that works, because we're relying on, while we do employ some OBGYNs, we're going to roll this out to all of our affiliates and not just the ones we employ. So we'll see how that process works. We plan to use our physician liaisons to help us disseminate the panel cards and just educate the OBGYN offices on the app. And so I will have to follow up with y'all later and give you an update on how that rollout works. And if
I'm sure if it doesn't go well the first time, you guys will figure it out and make it better. You'll just keep iterating until you make it work.
Yeah, I mean, we do have the benefit that we employ many OBGYNs, so obviously that'll be a little bit easier to manage. But then again, we have a lot of loyal OBGYNs that deliver at our hospitals, so I feel like they will be excited to have this option for their patients versus having to provide paper handouts.
Well, as you said, I'm sure they know firsthand just how millennial the audience is, and the fact that they really don't want paper and they don't really care about that packet of paper. Plus, they'll probably get a lot fewer calls into their nurses for triage about what medication can I take and what do I do if this happens, if all of that's available in the app.
Exactly. That's our hope.
Well, that kind of leads into our next question. And this is sort of, I'll combine a few just to, in the interest of time, but just really around the content and sort of the workflows. I know you mentioned really digitizing existing content. Did you guys have any questions as far as what content went in it? And sort of as an add-on to that, what was it that made you decide to do a custom app as opposed to just using something that was already maybe already available?
So with the bariatrics, it was a combination. Well, I mentioned they had an enormous book that they provided to all of their patients. And so we took that content and digitized it. It was there. It already existed. So that was pretty easy for the education piece. And then we also had a library of recipes already. So their app was pretty easy to put together. Again, we wanted to be able to have more custom options so that we could build in our content and create a workflow that worked for our practices and our services versus just having something that was already out there. Because particularly around bariatrics, some of the way we do things, I guess, would be proprietary in a sense. Our doctor was very particular about the way he does things pre-operatively and post-operatively. So it was important to him that we had a customized app. With the pregnancy, again, we looked at what was currently in our OB packet, what kind of content did we have in it, was it useful, was it necessary, and we pretty much took all of that information again and organized it and put it into the app. And then we looked at a lot of the trackers and that MobileSmith had and decided which ones we felt would be most helpful and just tried to organize the content in a cohesive fashion based on the different stages that you would be in pregnancy. And then we looked for gaps. Where did we feel we could build out additional content that would be helpful during your pregnancy or after your pregnancy? And then we started developing content to fill in those gaps. So I hope that answers those questions.
Yeah, I think so, and I think that actually answers quite a few of our questions. So I think with that, we'll go ahead and wrap it up here. But I did just want to say thank you so much, Krista, for sharing with us. I think, as much as time as I've spent in the apps, I still learned quite a bit today. So I think that I hope it was equally informative for everyone. But thank you so much for joining us and for sharing. And thank you, Dave, for walking us through all of that.
Yeah. Well, I want to thank Krista again for being a healthcare change agent. I mean, we need more of them in this country. And I really applaud you for, like I said, stepping out there and just making a difference every day to improve care.
Well, it's been a great process. I've enjoyed it. It's fun.
It is.
Great. Well, thank you all so much. We appreciate you joining us. And if we didn't get to your questions, then we'll be sure to have someone follow up with you and talk with you directly and maybe just see if we can look at your particular use case and answer any of those additional questions that you might have as well. Thank you, everyone.